Hello, everyone. Welcome to one more coffee break with forward-thinking and very inspiring leaders. If you have been here before, you know the rules of the game. It's your first time. Please grab a warm drink and get ready for a dynamic and less formal discussion than usual webinars. So let's get started. I'm Nicole de Paula, founder and the executive director of the Women Leaders of Planetary Health. I am speaking from Germany, where we are hosted by the Institute for Advanced Sustainability Studies, the ISS in Potsdam, where I'm also very proud to be the first Cloudstock for Sustainability Fellow. And on behalf of our amazing team, today I welcome you to the session, Tackling Inequalities for Planetary Health, which is a conversation with a very special and influential guest, the Executive Director of the United Nations Environmental Program, Ms. Inger Andersen. Welcome. And I don't need to introduce you too much in detail, but I also wanted to highlight that besides your current position, you have been recently appointed as the chair of the UN Task Force of the 2021 Food System Summit, which is a very important topic this next year. So we are incredibly proud to have you here with us, Inger, because you have been a powerful voice, really calling for nature protection as a fundamental way to protect human health. And that's a key message from our planetary health community. So today we want to continue this conversation on planetary health, but in the context of this massive disruption that COVID-19 pandemic is having around the world, but with a special focus on inequalities and specifically gender inequality. So our session is very short. We only have 30 minutes together. So I would like to invite you to open this conversation. If you can do that in 10 minutes, and then please, everybody, if you would like to pose questions, use our chat here and don't wait until the end of our presentation here to pose your questions. What usually happens is that we don't have time to answer everything, but we can continue the conversation through our LinkedIn group that you also find in the chat. Join us there. If you tweet about the session, just tag us as well. And with that, Inger, please, the virtual floor as well. We are truly happy to see you here with us today.
Thank you so much, Nicole, and thank you for inviting me. And I have to apologize because we had an earlier date, but thunder and lightning had other views and my Wi-Fi broke. So if there are people who are connecting second time around, let's cross fingers that this time it won't happen. No, look, I would just a couple of words on planetary health because we are in this crisis around COVID, and then a couple of words obviously on the imperatives of talking about gender and gender equity. We understand and we know that this COVID-19 did not come about by coincidence or by accident in the sense that we knew that a likelihood of a zoonotic outbreak of this manner, of this scale, of this catastrophic impact was getting ever more likely. Why did we know that? We knew that because we had interfered with nature, we'd encroached upon nature, we've illegally traded species, we have brought species together that have no business being even on the same continent, and we have done all of this, creating this petri dish. And as we've done this, we've also expanded our own footprint into wild areas, remote areas, and come into ever closer proximity to nature. And we need to understand that viruses live where they live and they have that desire to live and to spread. And that's what they will do. And so we've seen, whether it's Ebola, HIV/AIDS, Rift Valley fever, H1N1, bird flu, obviously, that is connected, Marburg, Nipah, all of these various diseases are zoonotic in nature. And what we got here was a quote unquote very efficient zoonotic disease, thought to be originating in and transmitted through an intermediary species into the human population. Efficient being because it's airborne, unlike other diseases where you have to, like Ebola, you actually need to touch blood or bodily fluids, which makes it more complicated in terms of the transmission spread. So bottom line is, let's understand the One Health context. Let's understand planetary health. So good nature management, good natural stewardship, good management of natural resources, and ensuring the integrity of nature, because we understand that there are studies that tell us that the more we have impacted on biodiversity loss, so the more the stress and species loss, the higher the degree of zoonosis. There are beginning studies in Zika virus spread around this, whereas the more diversity we have, the healthier the ecosystem, the less a spread. Why is that? Well, clearly when an ecosystem is in balance, you can't get these runaway diseases more easily. More research is needed. So anyway, we learned that take care of planetary health, take care of veterinary health, understand that side, and take care of human health. And you cannot deal with these as three distinct disciplines. Of course, you need to have medicine for each, but you need to understand that in complexity. So what does that then do to gender? And how does that whole thing interact with gender? Well, first of all, maybe I'm sure that everybody who's on this coffee break, and I'm sitting in Denmark and it is very hot, so I brought water and not coffee, I have to say, but here we are. And but people who are on this break probably know very well. But there has been some progress on the gender dimension in terms of empowerment, equity, voice, engagement, but we are not where we need to be. We still have 170 countries out of 189 that have been measured where women do not have equal rights under the law. One thing or another. It could be inheritance, it could be representation, it could be access to finance, it could be any number of things, but that is quite material. So even though you and I may feel that we have all these freedoms, there are in 170 out of 189 countries still inequities under the law. Now, we have nevertheless seen more girls in schools, more understanding of this, and we have seen more women in parliament, but still, out of every 4 members of parliament, only 1 is a female. So we still have some way to journey. And women are generally paid 16% less than men, and only 1 in 4 women are managing other people, are managers. So the kind of inequity that we are seeing is in job access, is in credit, is in going to court, in inheritance, accessing institutions, using property, all of those things, property to get loans because women may not have the same rights to property, your body and making choices on your the agency of your body, as well as other choices. So all of this means that at a time when this COVID hits us, there are countries where even movement is complex, women's movement, and there are countries where these absences of rights adds a different dimension. And add to this that the health sector generally in the lower ranking jobs, not necessarily the medicinal heads, are women. The nurses, the aides, the supports, all of those are women. So they are on the front line of the health, but may not necessarily be on the front line of power and on influence. And yet we know that women are often those that have more understanding of caring, nurturing, etc., because of our role in the homes. So now, we understand that there are some elements around COVID-19 where the impacts are likely to then discriminate more against women, as I just mentioned, as well as against groups with disabilities and other marginal groups. The UN and the Secretary General has actually come out on this quite forcefully. And we also understand that organizational structure, or the way in which society is structured, quarantine measures have led to an increase in stress and financial difficulty, and have led to a pandemic of domestic violence, of violence in the home against women and children. And we are seeing across the world, because before you could call, you were outside the home, you could seek help. Now you're stuck with your abuser and unable to seek help. So before the pandemic, we knew, just based on numbers, that 137 women died each day due to domestic violence. We don't know what the numbers are now, but we do know that there has been an absolute pandemic in this regard. Now, we also understand that when children are at home, and I'm aware that I have 2 minutes left only, so I'm going to rush out through the end of this, children at home and homeschooling, who takes that burden often is the woman, but she also often has to work online and be the primary carer and be the person that provides the meals. So the burden of the pandemic on women has indeed been seen to be significantly higher. One word on UNEP and UNEP's work. We are seeking to work in 3 areas. One is the zoonosis and working on the nature dimension and conservation. I won't go into that. 2, we also work on toxic waste, pollution, and chemicals, and we have seen this massive increase of plastics. And you could sit down and weep over this, because just when the world had reached a level of consciousness about phasing out plastics was exactly the time when we put all this additional plastics back into the mix. And so here we're working on waste management, incineration legislation, etc. And finally, building back better. Right now, we are seeing these huge subsidies, these huge boosters into the economy. Let's not make the mistake of build back gray, build back dirty, build back carbon intensive, build back nature destroying. Let's make the good choice of building back greener, building so that we can tip the balance in favor of our planet. Why? Because we have only this one planet, and we better take care of it. So now I am within 7 seconds on your 10 minutes, and I will stop, Nicole. Thank you very, very much indeed.
This is wonderful. So of course, you would be perfectly on time. This was wonderful. You touched on so many very important topics, and if you see and I liked how you started, because in the end, as you mentioned, and the people who are dealing with zoonotic diseases or dealing with this topic, they were not surprised by a pandemic. They would say, who could have predicted? And so basically, every person who was somehow studying this issue. So if you see that now, I saw some numbers from IMF that is costing rich nations, this pandemic, $9 trillion over 2 years. And so there is an economic case even for investing, in nature. So it's not only because I think one of the important things that the pandemic's showing is that it's not only, people are not so disconnected to the environment, and it's important to protect for our own well-being and health. So that's, I think, the beauty of the planetary health concept, that it brings this narrative and I think you spoke these days about also making the environment mainstream. So I wonder, after this pandemic, and you mentioned a little bit the work of UNEP, but we always have these questions: what are the challenges, right? To bridge these gaps between science and policy, which we continue to see somehow in key economies of our Western world, for example, and the issue of leadership. So that links also to gender, because perhaps we learned, I'm curious if you see from the personal perspective also, our understanding of leadership. What is a good leadership, what is not, and how do you think this pandemic, these perceptions of leadership and the role of women could impact a little bit the work of the UN? Because of course, UN also has the challenge of coordination, and that's not a new challenge, but right now, I think it's a very important way to show that they can deliver as one, to leave no one behind. So I'm curious about your comments on that.
Well, I mean, one has to be careful sitting as a female to say some of these things, but I will say, and there's always an exception to prove the rule, but I will say, first of all, in no particular order, that countries that have been female-led have done very well in the pandemic. They closed down early. Now, there are countries that were male-led that did the same, so let's not exaggerate. But I think it's generally accepted that Germany, Norway, New Zealand, Denmark, and there were many, many others, of course, and countries led by men. But, women, well, we do not have testosterone. So maybe we care a little more, and we don't come with the macho solutions. We understand that nurturing, caring, and empathy are values, and values that are very important in leadership, and that the value of human life, you can't not not take care of it. Now, don't get me wrong, because I know that men can think that too, but I think you're getting what it is I'm getting at. The Secretary General has been absolutely key, and this is my second point, with respect to the UN. He's said, look, sort of saying, this is 2016, 2017, when he took his mandate. I'm going to have 50-50 leadership. I'm not going to mess around anymore and just slowly and surely increase by one woman a year. If we were to do that, we know that we would get very, very slowly on the average. If we were to close that global gender gap just by the normal progress, it'll take us 99.5 years as a society, as a global community, to reach gender parity. Enough already. So I think we've reached this point where women are, where enlightened leaders are stepping in and understanding that the voices in the room, if they're female and male blended, will be better and will be having a broader spectrum of views. And I think we're seeing that from corporate business as well. So that would be the second point. Now, my own point has been simply to call out some of these elements and to be very clear that in sitting in a leadership position, it is not power, that power that maybe in the old days was what was awarded to you when you were a leader, but it's actually something about how you can create a convergence and hear the views and create a culture of forward movement. And when it comes to planetary health and conservation and understanding that the planet can only take so much and can only sustain so much, that becomes very much an issue. It's not something you can't fake. Science is there, and you can't make it up. It's sort of the numbers that underpin this. And maybe very finally, just to say on this massive stimulus packages, putting them into and using them for investments in nature, investments in the green environment, investments in nature in cities, as well as in the remote, the wild protection. Because we know that our children, if our children grow up with green, the neurons in their brains get wired better. We understand that if we are exposed to green, we get more exercise and we get a different endorphins and we tend to run more and we enjoy life and we just sit back and smell the roses. So the very chemicals that our brains produce when we are in green is the same chemical that we give to patients for de-stress. And so there are many links to planetary health and human health here. Let me hand it back to you.
Thank you, Inge. This is fantastic. And exactly, I think also the IUCN was supporting the Nature for All initiative, showing exactly these connections between, you know, our health and the green spaces and how this. So I'd like to also invite our colleagues here in Melvine, who is based in Kenya, I think we have some questions from our participants, and perhaps you can also, Melvine, introduce yourself and help us a little bit to see what people wanted to know from you today. Yeah, can you hear me, Melvine? You're on mute? Just unmute? That's the most sad phrase this year, right? You're on mute.
Okay, thank you so much, Nicole, for the opportunity. I will briefly introduce myself. My name is Melvine Otieno from Kenya. I'm currently the Planetary Health Alliance Next Generation Fellow, and I'm also coordinating the Planetary Health Eastern Africa Regional Hub. And besides that, I'm also pursuing Masters in Environmental Health here in Kenya. And I'm also a part of the team of women leaders for Planetary Health. And I'm happy to support Nicole in the meeting today through posting. Yeah, I will take you through the first question from Sabine. I would like to ask that in the planetary health community, we often refer to the imagination challenge to fight the planetary health emergency. What lesson can we learn from the COVID-19 pandemic and the global response to it that we can transfer on strategies to tackle the climate crisis? Yeah, that's one of the questions asked from the participants.
Do we get another one as well? I think we have one here. I'll do is how to engage. We have someone from Elena Ramirez. Thank you for being with us. So how to engage international cooperation organization in the right direction, taking care of environmental and women, and does the UN has the capacity and authority to move all in the same direction? And perhaps I think we can complement that. There was a recent report from UNEP as well, linking gender, climate, and security. So I think that's one of the ways that how is this topic of environment is perhaps transforming and now could is not also innovative thinking happened before, but perhaps with more force today being a theme for the Security Council, for example. Thank you.
Thank you. These are huge questions, but super important ones. So the first one was, as I got it, was addressing, okay, so what is it that the tools and the lessons that we take from COVID to take to the climate crisis? Melvine, I think that was it. Yeah, I see you nodding, so that's great. Here, I mean, the first thing is sort of basic, and I'm nearly embarrassed to say it, but listen to the science. Right? I mean, hello, we've been saying that this was likely to happen, and guess what? It happened. Now, and the second thing is people did listen to the science once they heard it. They hadn't heard it before, and maybe we need to look in the proverbial mirror. Why could they not hear UNEP's call around the dangers around zoonosis? Now, but once they heard it, they really heard it. People believed the science. Look, the three major world religions had their high holy days, Islam, Judaism, and Christianity in April, more or less, when you look at the three high holy days, and everyone said, we're going to stay at home. We're not going to go to mass or to mosque or to synagogue for these high holy days. That's remarkable because it was the leaders of the religions that said, in the relevant countries, that said so. So actually there was a remarkable moment where people said, oh, we didn't listen to the science, now we're going to listen to the science. And one of the things we have to do is wash our hands and socially distance. And so they did. So that was a good thing. Now, and then mass mobilization, mass campaigns, governments leaning in and understanding that this will take a massive hit on the economy, but the only way that we can save people is by doing this. Now, there have been debates, how much, how far, how long on some of this. That's normal, and one should expect that. That's politics, and that's normal. But there's been never really any doubt that one needed to lean in on the economy, and that there would be economic costs, but then we have dug into our pockets, because government money is obviously ours, to facilitate an economic restart. So we take all of that into climate, and clearly, well, listen to the science. We have had IPCC talk about this for quite some time. It is time that we understand that this is not some conspiracy, but that actually climate change is very real, and that we are moving towards the tipping point. That species loss is very real, and once a species is gone, it's gone forever. That pollution and toxicity is very real and impacts human lives and livelihood and well-being, and often the poorest and the marginalized. So listen to the science, take action. Yes, enable the government policies that will drive renewable energy, that will drive nature conservation, that will reduce pollution. So secondly, and third, obviously, put money into the future, whether it's in all of these elements that I have just mentioned, and make that choice not polemic, but make it understood that it is that way that we secure our world. So that's the best I can do for the first question. On the second question, which I think was around gender, climate, and security. I took bad notes. You're gonna have to help me, Nicole.
Yes, they were saying, I think it was again disconnections of the agencies, how the UN system. I'll join. I just mixed with. We also have, thanks Mark Lawrence, also our director, one of our directors from ISS is joining us here today. He's very excited, thanking you for the great talk. And he's mentioning here, so sorry Mark, it's a long tag, so I'll just cut a little bit here. So do you think we can learn something particular with this crisis to help policymakers worldwide to take scientists' warnings more seriously as you're saying, and is UNEP doing anything specifically on that already? And then we can mix, which was a question that I also had, we are this new knowledge hub and a network to emphasize the leadership, the importance of gender as a solution, also gender equity for a solution for, sustainability and health. So what our networks, how this Women Leaders for Planetary Health could help in this, it's about, I think, this women supporting women, but we are about to launch a mentorship program, for example, because I think a lot of this is about soft skills that we need to give our younger, generations, and even older ones, the people who are maybe used to a mindset. So I think we're curious to, hear from you what kind of, and I think we only have 4 minutes left, and we will be also finishing on time. So I think did you have a mentor, for example, in your career? And do you think, how do you see now when you do have the power? And like I said, it's not about holding the power, but of course there is a pathway to get there, right? It's not out of luck, especially for women. Doesn't matter how competent they are. There's still, it's a contextual. So we are curious to see if there anything specifically that UNEP is doing to improve the science, and what how mentorships, for example, of organizations like us could support to empower women.
First of all, I think that we need to understand that, and the Secretary General often speaks about that multilateralism of old is not the only answer. You need to have that inclusive multilateralism, which is not just government representatives. I get that they are the owners of the United Nations, but you need the voices of the youth. You need the voices of indigenous people. You need women's voices. You need the voices of private sector, etc. And today, when we know that the marketplace for ideas is not really amongst governments, but is really much, much broader, we need to have a more inclusive multilateral discussion. So what we've tried to do in UNEP is exactly that, to broaden out, to enable a deeper participation. In view of the time, I don't have time to go into it, but that's something that, and that's why I'm talking here to you today, because we want to really ensure that we can be as open and as inclusive as possible, because no, the answers do not lie that UNEP can fix it all, but the answers lie that UNEP needs to offer up a platform upon which we can crowd in initiatives and connections to enable that global movement, and to facilitate that the policymakers, who are the elected people who lead countries, can make the right decisions. And I had a wonderful mentor, and I have to tell you, it's early on in my career, and he was a he, it was a gentleman from Zimbabwe, and he was a path breaker in his own way, was a path breaker where I was working, and he was the first African in that position. So he broke many other barriers, and he was a very senior person in the place where I worked. It was at the World Bank, and he opened up an opportunity, and I saw in him this gentleness of leadership and a steeliness of determination all at the same time. And I thought, when I grow up, I want to be like him. So what we're trying to do in UNEP is precisely encourage young people, and hearing what you are doing with mentorship, this sounds super interesting and something we should definitely pick up at another time, because Nicole, that sounds really, really interesting, and bravo to you for doing that.
Well, Ingrid, we are so proud. I think we have so many questions. I apologize to our participants because obviously we don't have the time to take them all. Usually, please, we can continue our conversation. We are trying to build this community of practice of people who are interested in these questions through LinkedIn. So I can only thank you, Ingrid, so much for and especially finishing with this inspiring story of a personal, because I think everyone has, I think illustrates better and gives this humanity. And of course, we're very proud of your work. Please keep advocating for our planetary health, and and doing all the great job that you're doing. And we are very proud to have you here today. And I thank you, everybody, and especially Melvine and Meike, who was here helping us, setting up this. We didn't have a storm today. Everything went smoothly. So we are finishing precisely on time. And with that, I thank you, everybody. And I hope to see you on next coffee break, that usually every 2 weeks we have one session. So with that, thank you all.